Welcome. We are at Island Foot and Ankle. I'm here with Dr. Ben Overley, and we are getting ready to talk about all kinds of things. But you are a little bit new here. I know last time I was talking with Dr. Jeff. Tell us a little bit about your practice, and then we're going to get into some specifics.
Well, Island Foot and Ankle Surgery, we just opened up this past November. We both come from very large metropolitan areas. I'm from the Philadelphia area. My partner, Dr. Young, is from the Detroit area. I think in terms of our practice and our growth, we're very happy with that. Of course, we can always grow a little bit more, but for where we're at in terms of starting, we're very happy with the progression here. So I think everything has been moving along great. We're a surgical focus practice, so this is not a kind of a routine foot and ankle care place that you would go. However, we do treat a lot of non-operative conditions as well as doing foot and ankle surgery. In fact, I would say conservatively, of the patients that I see, I probably only operate on about 40%. So there's a lot of other ways we can treat your foot and ankle issues here at Island Foot and Ankle Surgery.
Nice. So let's talk a little bit about, we're going to get into some sports injuries right now. And of course, a lot of people active on the island. We've got running, golf, biking, tennis, all of those things. So tell us a little bit about sports injuries and how we know when we need to come see you and what we can do about it.
Certainly. And you left out a big one, which is pickleball.
Oh, pickleball, yeah, very new
yes.
and way hot right now.
Yes,
yeah.
And we see a lot of Achilles injuries with pickleball. It depends on the sport. If it's traditionally, a high school athlete that's, in volleyball, basketball, football, those types of things, those are typically going to fall into the ankle sprain or foot sprain category. And when you think about ankle sprains, they comprise 40% of all orthopedic injuries that report to an emergency room or urgent care. So that's a huge population, and we specialize in doing that. What do you do, or how do you know when it's time to seek treatment is always really the rub, because oftentimes if you come and see us right away, there's a lot of things we can do for you right out of the bat to not only reduce inflammation, reduce your pain, but get you back going a lot faster versus if you try and self-treat, which is, we're all humans. Human nature is to try to fix it yourself. But these particular injuries, they can also end up being very complicated sprains of the foot and ankle, which, may require surgical intervention. And if you miss that window of us treating you, then you're moving on to something a lot more significant in terms of a surgical intervention.
Okay, so let's go back to the self-care for a second, because if somebody does think they need to come in, should they do nothing? Is there something they really shouldn't do, or maybe something they should do to kind of at least get them here or get it to a place where it would be good to get you the next day if it's in the night or whatever?
Sure. So, I mean, we typically, because we really care about the people here on the island, and we do know that everybody is extremely active here, which we love. We are ourselves very active guys. So, in terms of, if I could give just 10 cents worth of advice, if it's so bad that you can't walk on it, you probably should be coming in to see us. Typically, sprains and strains respond very well to RICE therapy, which is rest, ice, compression, and elevation. However, I've never seen a patient put on an ACE bandage the correct way. So I leave the compression part out of that, leave that up to us. But if you elevate, ice it, and just get off of the area and then make a determination in the next day or two, when you try to step on it, if you're still having that much pain that you can't bear weight, that's definitely, you need to seek treatment. You're going to need dedicated x-rays and other studies, possibly like MRIs or CAT scans. And then the other thing is too, a lot of people get muscular pulls. So whether it's a calf strain or a calf pull or even a calf tear, which is very common with people that run on the beach. Your heel goes in a hole or a divot, which are all over the beach. And when you do that, when you get home, make sure you use heat. Do not use ice. So that is really the only time that you ever want to use heat, is if it's muscular. Okay. If it's in or around a joint, there's you suspect bone involvement, or you hear a pop, that's typically a ligament. That is not a bone that's breaking, that's a ligament popping. Those you want to ice and just get off of it, elevate that lower extremity, and take it easy from there.
Okay, all great advice, and I know I'm very guilty about the ace bandage thing, so I won't put one on again.
Okay.
Thanks, Dr. Ben. We'll see you again soon.
Okay. Thank you.